Hello and welcome to video 16 of the endocrine system for anatomy and physiology. In our last video, we talked about two of the three adrenal cortex hormone categories, mineralocorticoids and glucocorticoids. And we looked at how cortisol, which is a glucocorticoid, was regulated by the pituitary system. We're going to look at the final class of adrenal cortex hormones, which are adrenal androgens, and we'll look at two conditions or syndromes resulting from improper secretion of adrenal cortex hormones. So adrenal androgens are the last category, and these are produced in the zona reticularis region of the adrenal cortex. So this is the deepest layer of the cortex. And this secretes androgens. Androgens are stimulatory hormones, and they are responsible for development of male secondary characteristics or sex characteristics. And the effect of these in males is pretty much negligible because testosterone is going to just be so prevalent that these really don't have an effect. But in females, this does have an effect. This is responsible for pubic and axillary hair. Surges of this can also result in a lot of extra sebum production, which we know causes a lot of zits and acne during this time period. And if secretion is abnormally high or before puberty, and this would be in males or females, it can result in early onset puberty. So if something were wrong and with the adrenal cortex and adrenal androgens are secreted in large amounts, maybe with like a 5 or 6-year-old, either boy or girl, we could see armpit hair, we could see pubic hair that would develop. So those are the adrenal androgens. We have two different conditions that we're going to look at, and the first one is called Addison's disease. Addison's disease is also called chronic adrenocortical insufficiency. I'm not too worried about writing that down, but what this does is it results in low levels of cortisol and or aldosterone. And there are a lot of different things that can cause this, like tumors, infections. It can also be autoimmune. They're not really sure about what exactly causes this, but with this we have a decrease in sodium levels in the blood. We have an increase in potassium and H+, which can result in muscle tetany, which would not be good, muscle weakness, acidosis, which is abnormally high levels of H+ in the blood, which results in a lower pH. It can result in increased urine output, and it can cause weight loss, especially with cortisol. And just an interesting note, one of our most famous presidents had Addison's disease, and that was John F. Kennedy. So Cushing syndrome is an increase in cortisol and or an increase in androgens. And The biggest cause of this one is non-pituitary hormones, but it's caused by an increase usually in ACTH production, which then results in more cortisol being produced, and that causes an increase in blood glucose levels, and that's called hyperglycemia. A very big decrease in immune function, and that also can cause a decrease in muscle size. So we have atrophy and weakness. And one of the telltale signs of this one is something called moon face. There's increased fat deposits that form in the neck, the face, and the trunk. So you can look in your book on page 451, and there's a picture of a male patient that has Cushing, and their face becomes more rounded and moon-shaped.